Today I want to spend a few minutes talking about oral cancer. When most people think about cancer, they think about the more highly publicized cancers, such as breast cancer, prostate cancer, and cervical cancer. However, it's important to realize that oral cancer is actually 3 times more prevalent than cervical cancer. It kills approximately 1 person every hour of every day in the United States. Each year, there are approximately 30,000 new cases of oral cancer diagnosed. Of these, 50% will die within 5 years. We can increase that survival rate to 80 to 90% by early detection. Unfortunately, only approximately 35% of oral cancers are detected early. This we want to change. It's also interesting to note that the risk groups are changing. It used to be that oral cancer was mainly found in older males who had a long history of alcohol and tobacco use. This is changing. HPV virus, the human papilloma virus, is found to be one of the leading and is soon to be the leading cause of oral cancer. Unfortunately, this shifts the age groups down to the younger age group and particularly younger females. Historically, males had a 10-to-1 ratio over females. That has now changed to 2-to-1. So the younger group is the fastest growing segment of the population. So how do we address this? Well, we need to detect oral cancer earlier. And what I would like to do today is demonstrate how easy, quick, and painless an oral examination is. Historically, oral exams were done just visually and by palpating the tissues. And we start with the extraoral tissues. We're looking at the lymph nodes. We're actually also looking for any possibility of skin cancer. Once that's completed, we can turn our attention inside the mouth to the intraoral examination. In here, we visually look at the tissues and we also feel the tissues for any unusual lumps or bumps that might be there. We check the cheeks, we check the lateral borders of the tongue, we check every aspect of the intraoral tissue. Now today, we also have a new technology that is allowing us to detect oral cancer at its absolute earliest stages. And this is called the VELscope. The VELscope uses fluorescent technology. It's FDA approved for oral cancer screening. What it does, as you'll see on the graphic, is it allows us to look below the tissue where we can see visually. We can look down to the basal cell layer of the tissue where all of the oral cancer and premalignant changes initially start to occur. The other graphic also shows what we're looking for in the mouth. And one side of the graphic shows the lesion as we see it visually. You can't see it. And what it looks like with the use of the VELscope. So the net result is we can detect oral cancer much earlier with the VELscope than we ever could with the naked eye. And as you can see, the examination is very easy, it's very quick, very painless. The complete examination only takes about 2 to 3 minutes to complete, and it can save your life. The recommendation is that all people 18 years of age or over have an oral cancer evaluation at least yearly. You can get more information about the VELscope and oral cancer in general by clicking on the Patient Resources tab of our website.